coronavirus national effort. We understand how significant these steps are. We ask for your forbearance, but I think that the public knows that this is important, and they know how vital a task it is that we get a grip on the spread of this virus and slow it down. The more we follow the rules, the sooner we will stop the spread. And so everybody has a responsibility to follow those rules and, where possible, to stay at home. I know how worried people are, and while this is a great time of turbulence, it is a moment too that the country can come together in that national effort. As the next step in that effort, today we launch NHS Volunteers. We're seeking 250,000 volunteers, people in good health, to help the NHS for shopping and for delivery of medicines and to support those who are shielded to protect their own health. The NHS Volunteer Responders is a new scheme set up so that people can come and help and to make sure that the NHS and the local services that are needed get all the support that they can. I can also announce that the call we made at the weekend for people to return to the NHS has been incredibly successful so far. So far, 11,788 people have answered that call. 2,660 doctors, over 2,500 other health professionals and pharmacists, and 6,147 nurses. And I pay tribute to each and every one of those who's returning to the NHS at its hour of need. In addition, from next week, 5,500 final year medics and 18,700 final year student nurses will move to the front line to make sure we have the people we need in our NHS to respond to this crisis. In total, that's over 35,000 more staff coming to the NHS when the country needs the NHS most. Finally, I can announce today that we will next week open a new hospital, a temporary hospital, the NHS Nightingale Hospital, at the Excel Centre in London. The NHS Nightingale Hospital will comprise 2 wards, each of 2,000 people. With the help of the military and with NHS clinicians, we will make sure that we have the capacity that we need so that everyone can get the support they need. But no matter how big we grow the NHS, unless we slow the spread of this virus, then as we've seen, those numbers will continue to rise. And that's why it's so important that everybody follows the advice and stays at home. The final point I want to make is one of thanks. As Health Secretary and as a citizen, and on behalf of the whole country, I want to thank the staff of the NHS, those who work in social care, all of you, not just the doctors and nurses who normally get mentioned, but the pharmacists, the paramedics, the managers, and all staff across the board. You are the front line in this war against this virus, and we all pay tribute to you. You're going to give your all over the next few weeks, and I want you to know that we salute you, and I will strain every sinew to get you everything you need to keep you safe so that you can do your job, keeping all of us safe. We're now going to go to questions. The first question is from Laura Koonsberg, the BBC.
Thanks very much, Secretary of State. We've heard from many members of the public today who are being told that they should go to work by their boss, even though they don't think their work is essential right now at this moment, and they don't feel they can stay safely 2 meters apart from everyone else there. The message to many people has not been that clear from the government. Who are they meant to listen to, their boss or the advice from the government? And can I ask that question to the medics in a different way? If people feel they're not safe at work, what should they do? Should they stay at home?
Well, I'll give the first part of the answer, and then I'll hand over to Jenny as Deputy Chief Medical Officer to give the medical view. The advice is crystal clear, which is you should stay at home unless you have one of the 4 reasons, which is exercise, shopping as little as you have to, for medical reasons, or to go to work where that work can't be done at home. And if you're a key worker, for instance, if you work in the NHS and social care, then you should go to work because that work is vital in the effort to tackle coronavirus. Jenny.
Thank you. Thank you, Laura. I think the important thing with all of these questions is to take us right back to the first principles of why we have asked for these interventions. It is to prevent transmission of disease, and the rule about the 2 metres is to ensure that we are consciously keeping apart from each other so we do not inadvertently pass on disease if we have it. So I think when you're talking about work environments, exactly as the Secretary of State has said, there are numerous occupations where you do not need to be at work. Some of them we have to, and we recognise the support of our key workers, as Secretary of State said, in providing that service. But many don't need to be, and I think we are encouraging our employers to think really carefully about how they can innovate in the way their staff are working, and if they do need to be in the office, just to spread people around. I know, for example, for a few of us who are having to be in environments, actually there's an awful lot of space created, so you can practice safe distancing at work. I think it's a common sense principle, and we all need to apply it, both employers and employees.